Our panel is called Complementary and Integrative Techniques for Voice Therapy. And the approach that we are taking, and these two individuals are masters at it, is number one, complementary, meaning that we are offering voice therapy techniques that will work with the existing medical treatments you're getting, Botox, surgery, whatever you're choosing, to hopefully enhance and make that better, to deal with some of the things that go along with SD, which you all know about the tension and different other vocal characteristics that happen, and integrative, meaning that many of the techniques that these folks will discuss they enhance what's already been discussed this morning in terms of the neurology that we know about, and hopefully continuing as research continues and collects more information, we'll be able to hitch on to things that are known and be able to help even more. So brief introduction. Feel free. I hope we have time for questions afterwards. We want this to be an interactive type panel for you all to ask questions. So I'm going to turn this over to Joanna first, and then she'll present her take on all this, and then Kenneth will follow, and then hopefully we'll have time for questions. Okay?
I'm going to try to speak from here. I hope you can hear me. I tend to get lost behind podiums, being stature impaired. I became a speech pathologist after a repetitive strain injury to my arms ended my career as a folk singer by night and a typist by day. So as I was listening to your stories last night, I had a lot of similar feelings, remembering the grief, the disorientation, and the sense of dislocation that I went through along the way to making a major career shift because of an injury. I'm delighted that speech pathology kind of found me because it has suited me so well, and I'm delighted to have been part of this profession for 20 years now. I see my role in treating disorders like this in several ways. And I will be honest and say that my clinic at Cedars-Sinai does not see a lot of spasmodic dysphonia patients because most people in the LA area go across town to UCLA where Dr. Burke works. However, if any of you would like to work with me at Cedars-Sinai, there is no great chasm between the two other than political. So you're welcome to come and make friends with us on the therapy side if you would like. In general, I think the role is, number one, simply to deal with managing your symptoms. Whether you're going through various stages of the Botox cycle, the breathiness, the golden period, and then the reoccurrence of symptoms. There may be various communication strategies, how and when you're using your voice, as well as more detailed vocal techniques that may be helpful during those different stages. This involves relaxing what's tight, strengthening what's weak, resonance work, pitch, breath, many of the things that you might have encountered before diagnosis and were presented, well, that's not fixing it, that's what's wrong with that. Well, these things don't fix, but they may ameliorate, or they may help prolong your periods of good voice. I'll be talking quite a bit more about breath this afternoon and breath timing because there is an intricate relationship with how the breath works and how the vocal cords work, but I'll save most of that for later. We can also help with the general integration of voice with the rest of your life, with your career demands. How and when you're using your voice, other what we call vocal hygiene strategies, with the general impression or goal of reducing the overall load on your larynx so that your vocal cords are in the best condition emotionally, humidity-wise, breath support-wise, pitch, resonance, all of those things, so that your cords have the best chance to do their job of vibrating and responding to speech and to what you have to say to the world. We also have a role as counselors. We have seen voice disorders. We appreciate more than the rest of the world does how important voice is in quality of life, that it does represent both the personal identity and your relationship to your social world. So while we don't take the place of psychological counseling and even trauma counseling that may be appropriate for a serious diagnosis and the adjustment process to that. We don't take the place of counselors, but we do kind of get what you're dealing with, and we try to be helpful listeners and problem solvers in that regard. There is a recent study showing that a chronic dysphonia has the same effect on quality of life as loss of a limb, chronic heart disease, and other things that the general world recognizes as major blows to identity and social role. Dysphonia is up there, and we're the folks who understand that and are happy to listen to your concerns about that. Overall, I think as speech therapists, we may be able to help with what's called self-efficacy. That is your sense of having some control. We're not saying that we can control the parts in the brain that we still haven't identified that are glitchy and not working right, but we may help you find some control over everything else that's affecting your vocal function, and so improve your quality of life from that. And I'll turn it over to Ken, see what he has to add, which is a lot.
You can have the podium.
Oh, sure. Well, can you guys hear me? Yeah. Okay. She took all my juju away. She had good stuff, right? Good stuff. Because she's starting to talk about quality of life and all those human tools you have to make positive changes in your life. By the way, we've been very brain focused. Would you mind standing up for me and like breathing with me? You feel your butt becoming more alive now already? Okay. Question 1, can you feel your feet? If you can, I want you to use your toes and make a little fist with your toes and let go. A little bit tighter fist with your foot and let go. I know I'm messing with you because I'm doing it with my hands. Third time, grip, 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 and let go. Thanks. Now let's do that with our hands. Let's put them right in front. I feel things being attached to me. And slowly bring the hands together into a fist and squeeze, release at the wrist and soften. One more time. Bring the fingers together, thumbs over, and squeeze. Back up your fists. Let go of the wrist. One more time. Grab into a fist. Ooh, that's loud. Back up and release. Inhale with me. Out on shh, shh. Torso fills up, arms go up. Shh. Come on, I know there's a lot of you out there. Be louder than me. Shush me. Same arm movement, double sniff. Now you feel a little more like you're one piece? You may sit down if you wish. You may stand up if you wish. You know, sitting is the new smoking. Bad for your spine, bad for your nervous system, which is bad for you, period. Of course, it's not good to stand still, which is why I do the bus, waiting for the bus thing all the time. My students think I'm insane. It's actually a very slow-mo qigong kind of a thing. Anyway, Joanna was broadening the concept of the experience of living with a condition. And my yoga teacher says we're all born with, actually I just gave the joke away, we all have a terminal condition, a terminal diagnosis, and it's called birth. Many of us are closer to the terminal condition than we are to birth, so we have some perspective, more perspective than maybe some of the newbie docs or newbie speech pathologists that you'll see who are in their 20s. They can learn a lot from you if they're willing to learn and have open minds, open ears, and open hearts. My background is actually in singing voice, in speech science, and in speech language pathology. In terms of, my larynx just moved down here like that. I breathe down here, so I guess I talk down here now too.
We have to get the sensory feedback loops correct here.
Okay, yeah.
To avoid
Inhale,
the feedback.
exhale. But the idea with incorporating yoga tools is to address some of those human abilities we have to manage our symptoms, to reduce symptoms when possible, to cope with what is not changeable, and to improve our overall life. I was really inspired when I heard Charlie said that the main summary he uses for the mission of the association is to help persons with spasmodic dysphonia to live better lives. And that's really the mission statement of yoga. It is the heart of yoga, to help people access tools they already have. A body, a sensory system, a mind that works on many levels, and an emotional heart that processes our lived experience in our bodies, and to somehow make it better for ourselves. I was struck when Mark was talking about voice-related quality of life, and he brings up general health. Our health is not just our one condition. Many of us have more than one condition we're working with in life. Social function. Our arms, our feet, our skin is what we use to touch and move the world around us. Our voice is what we use to touch the hearts and minds of the people and animals around us. So it's vital to our quality of life. Mental health, emotional health, mood balance. These are all critical things for us in the middle stage of life when you have a lot of responsibilities. So if you are tired, if you are frustrated this day, if you haven't had enough sleep, if you're feeling very frightened but also angry at the same time, what kind of decisions are you going to make? I know the kinds I do, and I try not to make them, because I know my physiologic state, my mood state, my crazy vagal nerve is going to push me towards decisions that are unwise. So I use a higher wisdom within, which may be the higher wisdom without, and I step back until I can be in a better state. The greatest gift, I think, in my yoga training is the breath, the centrality of the breath. So in the style of yoga that I bring to my clients and to my graduate student speech pathologists also, is based on breath work, because the breath is that conduit between our conscious mind, our vagal system, and emotional balance. This morning we did a brief half-hour session. Essentially, we just tuned into our body and our limbs to quiet them down a bit, and then we did a breathing exercise where we purposefully slowed down the rhythm of the breath until it was about 5 or 6 seconds, and then to appreciate the pauses between oxygen intake and release of the CO2. It was such a revelation for me when I first did this that my mood completely stilled with 12 repetitions of a breath that the body would do were you in a very calm state. So that was a trippy thing. I did something physical with my conscious mind over the breath, the respiratory system, which is usually on autopilot, but I have some voluntary control over it. And it changed my mood state. And I thought, that's power, that I can do this for myself. I didn't need a Valium. I mean, sometimes Valium's easier and it lasts a little longer, but I did that myself with my awareness, my attention, and with my own breathing system. It's the feedback that's always there. So that's one of the tools I use. Let me just give you one example. One of the tools we use for something called paradoxical vocal fold motion, when people close their vocal folds on the inhale instead of exhale, is this easy breathing through pursed lips, or this double sniff that we did. I had a patient come in after 6 sessions of learning how to do this, and I watched her do it. She sat in the chair, she went, just cool it and chill. Okay? And then I said, you have 2 little holes here that breathe for you, and I want you to let the air leak into your belly. And she'd try, what are you doing with your hands? Oh. Good, you're breathing in. Good, good, good. And I just let it go. What is your mouth doing? Oh, okay, I'll relax it. And we did this for about 10 or 15 cycles. And I said, that's how it feels, okay? Now you can add your lips if you want, but it appears to me you don't need to use them. Because I knew what the end product of that exercise was supposed to be, and I knew what it felt like. So someone taught her something she learned off a videotape or a class, had no idea about the quality or sensation of the end product, but she taught a technique. So it didn't really work. And one of my concerns is when I'm with a client is to look at the client's specific conditions, the specific gifts and tools she brings in that day, and to use those to give her something that day, and then we work from there. If she wants to become a yoga therapy client, then I can work with other tools. I can work with movement in addition to breath, knitting them together. I can quiet down the body and see where she moves in something towards prayer or meditation, which then allows her to maybe start moving towards changing attitude towards how I perceive the quality of my life with this condition. Am I this condition? Who the heck am I anyway? Am I my personal history? Am I my meds? Am I charts in different doctor's offices? What is my lived experience? And so this is what I think on a larger level, yoga therapeutic tools can take us. Many of you, I know, take exercise classes, so you get that movement part of yoga, but the breath is extremely powerful. Concentration and meditation techniques are extremely possible, and the use of sound is also very powerful. If you think of meditation as a placeholder word for deep stillness, movement towards something like prayer, if you have a prayer tradition, you are in a meditative state. Concentration or visual exercises, if you've done Vipassana or Buddhist-oriented meditation, all of those move us towards that state where maybe for a glimpse, you can see who that person is, who you are, without the brand name history, without the condition, without all of those, because that's been there since you were born, this deep awareness, and it is a huge tool. Most of us are too frazzled and distracted to know it's even there. And those of you who touch it occasionally with the tools you have, you know you're blessed to have those tools. So I'd just like to end it there, because I'd like to hear your questions. That's more important to me than anything else.
Do we have any questions?
Come on.
Can we breathe some more?
Pardon?
Can we breathe some more?
You are permitted to breathe in this room.
Actually, we can if you want. Let's do one more thing. Let's stand up. It's very interesting in our respiratory system how sensations in the lower half of the torso and the seat, that's a nice word for, your butt and in between your legs. The sensation in the lower half of your body, the abdomen, versus the sensations in your rib cage and chest. And so one of the areas of customization for breathing technique in yoga is to locate where the best area of concentration are. Now, many of you have heard of so-called diaphragmatic breath, and I'll let Joanna espouse on that and correct some of the misconceptions later, because there are loads of them, right? But the idea of low breathing is something that is related to when we're at rest. It's really just the movement of the diaphragm up and down. It's something you do when you're calm. The pace is slow. So what I'd like you to do right now is just to have your hands touch the low belly. I'd say at the belly button area or so. And I want you to bring your attention to the tips of your nostrils and allow the air to flow in through the tips of your nostrils, and just observe with your hands what your abdomen does. Don't force your abdomen to do anything it doesn't want. And release the air with an open, slack mouth. Noisy if you want to, silent if you want to. If it's silent, that means your throat's loose. Let's do that again. Tips of the nostrils. Let's hold it there. Push out a little, just lean out a little. And again, let go, slack mouth. This time, we'll let the inhale in and see if you can lean out slightly on your belly, but leave your throat completely open, like you're happily surprised. And let go. So I've tricked all of you into breathing at least 4 times very slowly. And I don't know if that changed the state. That's usually not enough breath. But there's a certain feeling of, I'm here, I'm not nervous, whatever, I'm ready for it. Now let's bring our hands, I have very short arms, so I tend to do rib monitoring with the back of my fingers. Some of y'all have octopus tentacles and you could wrap them around, but I have very short arms, so I put the backs of my fingers over my ribs. Okay. We're now going to do a pursed lipped breath where it's like you're gently sucking air through a straw. Okay. And you're going to notice if your hands move out when you're gently sipping air through a straw. Let go through a slack open mouth. Sipping through the straw. Let go through the mouth. Next time we're going to go slower. Don't try to take so much breath. But slower. Just let it leak in. Take your time. Let it leak out. No need to push it out. One more time, just like that. A little sweeter, a little gentler, not so much breath pull, but let it be long. Let it take its time. It's like little arms on each side of your heart opening up. And let it release. I promise you only one more breath like this, through the straw. You feel the chest moving? Keep your attention there. Lean out the ribs. Lean out the ribs at the end of your exhale. Slack mouth. Push out on the ribs. Lean out. Feel how big you are. And let go. This is the breath equivalent of the cowardly lion doing that, right? Now you are big, strong, and your heart is protected. So there's this idea, when you feel anxious, you do the first to ground yourself, and then to make yourself feel less afraid or more powerful. You allow the strength that you get when you're doing upper body work come into your presence. Now notice these are very slow breaths. These were not the kind of chest breaths that we do when we're anxious and completely adrenal flooded and cortisoled out. Well, there's no movement. It's just, I'm freaking out, it's gonna kill me. You know, or that jerk just cut me off, I wanna kill him. You know, it's the same thing. You know, so this is the antidote. And you can do it, you've just done it. Let's stay standing for a moment, and any questions for any of us?
There was somebody over here a minute ago. No?
Please.
One word that Joanna said, and that was humidity. I wonder if you can expand on that, both as far as humidity in the place that we are, and also humidity as far as the liquids that we take in.
Great question. Thank you. You're asking, I would use two words, one humidity and the other hydration. Probably everybody here who's been to a speech therapist was told you need to drink more water, right? And that's true because it helps your vocal cords the next day. It does not touch them at the moment that you swallow. I think probably this group is sophisticated enough in anatomy to know that your vocal cords are in your airway, they're not where you swallow. Things go down the wrong way, you have a problem. So drinking water and any other fluid, and I'm not real particular about which ones unless there are other issues like acid reflux. I don't care what temperature, I don't care if there's a tea bag in it or not, whether there's honey in it or lemon or whatever. Whatever you're gonna drink the most of, or scotch, right, once in a while. Whatever you're gonna drink the most of is healthy for the body as a whole, and the vibrational layer of the vocal cords happens to be pretty sensitive to hydration. So it's got a jelly substance and tends to fatigue more quickly when the body's dehydrated. So that's the rationale for that. In terms of humidity, my understanding is that vocal cords and lungs in general, the airway overall, likes about 50%. And you might get that some days here in the Bay Area, where I live in LA, it's a desert. And so using a humidifier in the home or office, a dedicated steam treatment. Ladies, I know you probably know where to get those little facial things. They steam your face and they do good for your vocal cords as well. Steam showers, any of these tools, the less expensive the better, is a general all-purpose soothing thing for the vocal cords, especially if you've got big vocal demands, or if you have been at a social event with background noise and there's an inevitable sense of strain, an extra shower, or just lingering over a cup of hot tea at night just to get a little more steam in the airway, you'll probably do better the next morning. So that would be that answer.
Can I just add, there's There's a wonderful, very simple two-word tool. If you're not taking medications or supplements that are dyed yellow, like vitamin B often is, if you pee clear, that means you have enough fluid for the purposes of your voice, but maybe more importantly for your kidneys and for your nervous system and all your cells.
And your brain.
So it's important to stay well hydrated. I know I used some lip breathing and open mouth postures just for the exercise today, but y'all know that breathing through your nose is optimal because it filters and humidifies the air that goes in environmentally. So please take advantage of that. And if you can't breathe your nose, you should go to your ENT and see what's blocking it.
I take vitamins, a lot of supplements in the morning, and every evening, right when I go to bed, I take a calcium and E. I have dry mouth that wakes me up at least 3 times a night because my tongue is stuck to the roof of my mouth. And I've taken toothpaste and mouthwashes that are supposed to alleviate that. Nothing works. Does this have anything to do with SD?
I would doubt that it is related to SD. If you're taking are you taking calcium as a dry capsule at night?
Yes.
I'd be sure that you're taking plenty of water and allow enough time for it to go down all the way before you get into bed. A humidifier in your bedroom may make a huge difference for you. And really the only pushback I get from people on that is that it messes up their wallpaper or their hairdo. So if those concerns aren't huge, I would really recommend trying to humidify where you sleep. I'm also a big fan of, you say you've tried toothpaste and mouthwash. Biotine has a mouth spray, and even the generic seems to have enough good ingredients in it. I have had that experience of waking up in the middle of the night simply because my mouth was too dry. And I found that just a little bit of the biotine spray just before my head hits the pillow. And I'm waking up, I'm sleeping better, and I'm waking up feeling less dried out. So that's another option.
I think it's important to check to see why you might be open mouth breathing. So something you might ask your ENT is there a reason? Is there something in terms of my nasal breathing that I am doing oral breathing at night? Because that's about the only way your mouth can get really dry is to open mouth breathe. Mm-hmm. The other is if you would check with your medical clinician regarding the form of calcium, because citrate form, according to some studies, are much more absorbable and have less risk for kidney stone production than carbonate forms. So Tums taste good, but I don't use them anymore because the citrate form was recommended to me by my physician. So, but again, if you're not able to breathe through your nose, have someone check why you're oral breathing.
And one other little tip I give some of my patients with dry mouth. There's a new over-the-counter product called Xylamints, spelled with an X, and it's a little melt-in-your-mouth thing that does, my patients who've used it tell me it does a really nice job. Just pop one of those in your mouth before bed.
That xylitol ingredient in that is also in some of these mouth sprays.
Right, yeah. It's just another delivery method because some people don't care for the biotine spray. They say it doesn't last long enough. An organic, holistic, whatever you want to call it, thing that some of the head and neck cancer folks have reported. There's an enzyme in papaya. What is the enzyme?
I think it's papain.
Papain, that's right, yeah. Because there's a little of it in pineapple, but papaya, it's very concentrated. Dried papaya, little piece of it, tuck it in your cheek, and just let it sit there, and it will stimulate saliva production.
You know, the use of food as a source of improving overall health is an old tradition in Chinese medicine as well as in Ayurvedic or traditional Indian medicine. You may want to consider getting guidance if you feel like you're not taking foods that are optimal in terms of your body type, your digestion. So I just thought I'd mention that. We're talking about integrative techniques, and a lot of folks will do wonderful things in terms of helping themselves, and then they'll take in food that really pushes them in the opposite direction. Those of you, with a hydration thing, those of you who use a CPAP, get the humidifier. It really helps. When you have that strong airstream coming in the evening, it needs to be humidified because it's fairly forceful. It'll dry it out even if it's a 50% humidity.
Okay, thank you, everybody.
One more question.
One more question.
Anyway, this is for Dr. Tom.
Yes?
I was not able to attend your session this morning on yoga and breathing techniques. Do you have something online that I could find to use those techniques to see?
Simple answer is no, but I can certainly point you towards resources. If I think my email is on the biography. If not, Kim can get you my email, and I can point you towards some resources. Be glad to do that for any of you all.
I have a book called Everyday Voice Care that is a general guide to what we call vocal hygiene. It covers hydration, humidity, how to exercise to be good to your voice, and a lot of other strategies that people might find helpful. Thanks.